On Monday, the 24th of August, Prime Minister Johnson made a plea with parents to send children back to school, claiming that the life chances of a generation are at stake. For the past few months, the issue of schools and school children have been a big point of debate. Well, at least for the few of us that actually want to talk about the current pandemic. There is undoubtedly a risk in sending kids to school, through the increased risk of transmission not only within schools, but with the families of school children. However, there is also undoubtedly a risk in not sending children to school, through the lack of education for an extended period and the associated long-term risks, which the Prime Minister is alluding to. So, in this video, we will analyse these two scenarios, try and discover which one is actually riskier, and if it's too soon to be sending children back to school. Before we get going though, a quick shout out. To celebrate Jack's 24th birthday this weekend, we're offering 24% off all of our pin badges. If you didn't know, we make loads of high quality enamel pin badges of our Countries with Shoes design. And if there's a country you want, we likely have it in stock. Find the full collection in our store linked below and get 24% off with the code BDAYBADGE, meaning most badges are just £4.55. Anyway, the link's down below. So, let's first look into the risks that are posed by sending children to school. Over the weekend, the government has been keen to try and lessen the fear parents may have over sending their children to school, presumably in preparation for the announcement for the Prime Minister on Monday. One way they began to try and convince the public is by publishing a document by Public Health England that looks into coronavirus transmission in educational settings. So, let's have a look at what it says. Early in the document, it is stated that there are limited data on SARS-CoV-2 infection and transmission in educational settings. The reason we bring this up is that any conclusions drawn from the findings here should be taken with a pinch of salt. As ever, this is a new disease, and data covering a wide time span with a huge number of participants is hard to find. For this particular document, it only covers a time span of around 2 months. Nonetheless, it is useful data and it's interesting to see what is found. The first finding mentioned is that in June there were only 30 outbreaks of COVID-19 in educational settings, which consisted of 67 individual cases. The probable transmission direction of the 30 outbreaks were 15 staff-to-staff transmissions, 7 staff-to-student transmissions, 6 student-to-staff transmissions, and only 2 student-to-student transmissions. It's pretty clear what conclusion the scientists writing the document came to. That transmission in schools was uncommon, and that when it did happen, it was usually to do with members of staff in schools instead of students. They claim that additional interventions should focus on reducing transmissions in and among staff members. Another paper was published in Germany, which again looked into the spread of COVID-19 in schools. Schools in Germany opened in May, and the data is taken from children aged between 14 and 18 in May and June. This data showed that of the 2,000 children included, only 12 had COVID-19 antibodies. This led Reinhard Berner, a professor of paediatrics, to claim that children may even act as a brake on infections due to the fact that children had not caused outbreaks at schools. Yet another study was published which took place in France and looked at the infection rate between students in educational settings in February and March. This paper starts by explaining that children are less affected by the disease. Disease fatality is just a lot lower for them. There also appears to be more asymptomatic forms of the disease compared to adults. These findings are based on what was seen in China at the beginning of the pandemic. This also had similar findings to the paper published by Public Health England, most notably that transmission in schools was very unlikely, especially among children. It also found something really fascinating, something not found by Public Health England. Firstly, it found that viral load among infected adults and infected children appears to be similar. So it posed the question, why is onward transmission from children in schools not similar to that of adults elsewhere? One possible answer, it suggests, is that the milder symptoms among children reduces this onward transmission. In simple terms, if children don't have symptoms such as coughing, it reduces the chance that they will pass the virus on to people at home or at school. This could, A real emphasis on could here, though, be an explanation as to why children don't pass COVID-19 on either at school or at home. In addition to this, the paper suggests that 61% of parents of infected pupils are also infected, and 44% of relatives of infected pupils are also infected. This paper suggests that due to the low transmission rates from children, which has been shown not only by this paper, but by the Public Health England paper, it is more likely that the parents have infected the children than vice versa. It also cites a paper from China that makes a similar argument. This therefore backs up what Chief Medical Officer Chris Whitty claimed on Monday, that there is much less transmission from children to adults than from adults to adults. In fact, this could even be part of the data that he used to come to this conclusion. He also pointed out that, likely, a large reason that the virus may spread when schools do reopen is because of adults. He suggested that parents stood at school gates before and after school, and parents that go back to work as a result of schools reopening, may lead to an increase in the spread of the virus, and therefore an increase in the infamous R number. However, it is also important to point out that the French paper looked at the evidence from primary schools, and the Public Health England paper looked at preschools, primary schools and secondary schools, although only years 10 and 12, as these were the only years sent back after lockdown. Therefore, the evidence relied upon in this video is heavily weighted towards primary schools, which means that this may not be the case for secondary schools and teenagers. Chris Whitty even accepted himself that evidence for transmission from teenagers is weaker than for younger children. In fact, now is probably a good time for some caveats. This virus is new. It has not been around long enough yet for scientists to fully understand it. Although we've presented some evidence in this video that sending children back to school may well be safe, do not take us at our word. Both papers cited were conducted over a maximum of a few months and do not have huge sample sizes, nor do they prove anything. Whether it's actually safe for primary schools, let alone secondary schools that have less evidence, is still unknown. Although we've been criticised in some recent videos, most notably on videos about asylum seekers, for not actually really answering the question and just presenting evidence and then saying something like, "This isn't clear," we're not going to stop doing this. The reason there are debates around these things, and things we make videos on generally, is because the evidence isn't clear enough to definitively say anything. We're not just going to take some relatively weak data and say that one thing is definitively the right thing to do. This would be disingenuous. So, as annoying as it may be, while there is some evidence that transmission among children is lower than that of adults, some could argue that this isn't strong enough to open schools again, while others could argue that it is. In fact, as we aim to be impartial and present both sides, some could realistically argue that while the evidence shows that school children don't spread COVID-19 that much in comparison to adults, the risks presented by the increased contact between adults, such as the school gates or because more adults can go to work if children go back to school, mean that it would be unreasonable and wrong to reopen schools. As Chris Whitty has already stated, opening schools will have an effect on the R number, even if this isn't as a result of the child-to-child transmission. What we're saying is, this data could be interpreted either way, and could lead you either to support the government's plans to reopen schools, or not. Again, we're sure that people in the comments will make their views heard. Okay, so now we've covered both the arguments and caveats about the dangers of sending children back to school, we will now cover the potentially damaging effects to children of keeping schools closed. Firstly, services provided by schools to children are obviously lost when schools are closed. Access to mental health services, school meals, and cleaning facilities are lost. Having said that, the UK government has promised to keep free school meals going while school is closed. The other points, however, still stand. In addition to this, children can pick up bad habits when not at school. If parents are not pushing children to exercise in lockdown, it may be unlikely for children to have their 60 minutes a day of moderate to vigorous exercise, which is recommended by the World Health Organization. Break and lunch times, alongside PE lessons, encourage children to exercise, but this may not be the case when at home. In fact, The Lancet goes even further, claiming that this jeopardises not only young people's mental well-being and healthy weight status, but also increases the risk of establishing dangerous habits, such as increased screen time and snacking, that can damage future cardiovascular and musculoskeletal health. Another point made by The Lancet is that adolescents may not be learning to become independent from their parents in a way they normally would outside the pandemic. A big part of growing up is beginning to prioritise friends your own age over parents, which is difficult to do when you're stuck at home with your parents. In fact, they go as far as to claim that this can pose significant challenges to young people's well-being. They also make the argument that anxiety has increased for students out of school. An article by the Child Poverty Action Group adds weight to this argument by claiming that children of families who live in poverty will find learning at home particularly hard. They claim that chronic stress, worries about money, overcrowded housing, and insufficient resources make day-to-day life much more difficult. It is nigh impossible for academic learning to take place when a child's basic needs like shelter, adequate nutrition, and warmth cannot first be met. A Wired article also found that the lockdown is unevenly affecting those in a worse economic situation. Private school students in the UK are twice as likely as state school students to receive online lessons, and working class students are spending less time studying than others. Among those that live under the poverty line, therefore, simply living at home in the pandemic is difficult, let alone learning too. It is therefore obvious that the pandemic is exacerbating existing rifts between social classes, with those economically disadvantaged being even further disadvantaged by learning at home. And, although those living in poverty find this situation incredibly hard, surveys have shown that the vast majority of pupils are struggling with mental health issues as a result of being unable to attend school. The website Young Minds claimed that 87% of respondents agreed that they had felt lonely or isolated during the lockdown period, even though 71% had been able to stay in touch with friends. This is alongside 80% of respondents who claimed that the coronavirus had made their mental health issues worse. The Student Room also found that more people than ever were using their website to discuss anxiety and depression. This was shown by an increase of 77% of articles on these topics on their forum pages. Effectively, many students are not thriving under home learning, and the impact of school closures are already having a negative effect on students in the short term. Impact on students in the longer term are more difficult to find, as it is very rare historically for students to miss school for such long periods of time. However, in Argentina, following a 90-day teacher strike, pupils in affected areas were less likely to earn a degree, more likely to be unemployed, and earned 2 to 3% less than areas that were unaffected. While this evidence may not be the best, as it is only one example, and the difference in the country, education system, levels of government support, etc. differs hugely, it at least provides some insight into the possible outcomes if education in schools is not resumed. It should be stressed though that this evidence doesn't prove anything and should just be used to illustrate what could happen, not what will happen. But what do you think? Do you think the risks are worth it? Is the evidence for the safety of reopening schools strong enough to actually reopen them? Let us know in the comments below.